Hi guys, so I want to continue with my location shock um experience. So today I'll be talking about the episode 6, which is the healthcare system shock. So my first experience, honestly, I didn't know it worked this way. First of all, for you to access the healthcare services in Canada, you need to get a health card. So the health card took me and my family for took us 3 months to get it sorted, because without a health card we'll be able to have access to the doctor. So there are difference between going to the hospital and going to your family doctor. So for the family doctor, after getting the health card, we'll now have to apply. That one took us for another 5 months to get a family doctor. But before the family doctors started, so we're visiting the hospital. So for instance, the first time I visited the hospital, I was with my son, and we need to visit the hospital. Honestly, nothing prepared me for this, and you think you just walk in after 30 minutes, you or an hour at most, you get to check in, get answers, and get home. Instead, we found ourselves sitting in the waiting area asking, where is the doctor? Why am I still here? The system is good, yeah. It is organized, people are polite, and even they don't pay out of pocket for every little thing. But the waiting time can take or test your patience. Yeah. You see nurses, they will, triage you, ask questions, but seeing the actual doctor, it feels like waiting to see a celebrity appearance. By the time they finally called his name, and I've already questioned my entire life plan, scrolled through my phone, mentally written everything. And funny part is, everyone around me was calm, like it feels normal. That's when it hit me that these Canada people, there are a lot of things they don't talk about. The care is good, but but you need patience. Yeah, real patience. It was a shock, but now I get it. I settle in, you know, when I have to go, I will just get my snack or charge my phone or scroll on my phone, waiting for the fact that I will actually see the doctor. At times, it will take 1 hour to 3 hours, yes, for a general hospital like that. But the case is different if you're going to your family doctor. For family doctor, you book an appointment, of course. You call in and they check the available time. And when you come, you're looking at a doctor that, they have a structure. You just get in, you talk to someone who knows your history, and you're out. So it doesn't take much, like 30 minutes, you've seen your doctor, the family doctor. So, like I said, there are two things to it. You should have a health card. That's the most important. And if you don't have it, to access healthcare, you have to pay. You have to pay so much to access it. In fact, getting a card to even see the doctor, like if you don't have a health card, you just come into the hospital, can cost you up to $1,000 to just get a card to get your file ready. You understand what I mean? Not to talk of the medication. So health card, it took us like 3 months, we got it. And then family doctor, it took us another 5 months to get a family doctor. So these are the things you also have to know. So my advice is, before coming into Canada, you could have some of the pain relieving medications you can have handy. But of course, if you want to go to the pharmacy to buy all those over the counter medication, like pain relieving, you can get. But some serious cases, like if you're diabetic or you're hypertensive, you can't get the drugs across the counter. A doctor has to, you know, prescribe prescribe those drugs for you. Yeah, you should have your prescription before coming. Nobody will attend to you. So that's why you still have, to get all this ready and also prepare for it. But why they are not still, you are not still getting all those documentation, you need to have something, so that if there are emergencies or case like you fell ill, at least you can use what you already have, pending when you complete everything and get access. And the people I'm talking about now, people that have like people, I came as a PR, so basically that's the knowledge I know. I don't know about students and how they're doing, and then those visitors, I don't think they are entitled until their papers are confirmed or something. So I think this, I have made some points again for you today, and do have a beautiful day. Bye.